Electrical stimulation for anybody with a neurological disorder gives them the ability to activate their muscles that are no longer able to be activated from their brain. And by activating those muscles, it's kind of a common sense approach to helping people, give them the ability to rehabilitate themselves, because normally there is no cure for like spinal cord injury. There is no cure for MS. There is no cure for stroke. So they don't have to suffer all the comorbidities and any of the side effects that are a result of these neurological disorders. We have some patients who have been using our devices for over 20 years. They have successful, incredible quality of lives, and they say that our products are the core reason that they're able to do that.
I was actually the first person in the country to be able to purchase the RT300. Since then, I've rode thousands and thousands of sessions. It's just an amazing feeling to be able to move again, and I get a really good cardiovascular workout, and my muscles are built up where, usually for a quadriplegic, they're supposed to be extra skinny, and I've got extra muscle, but it's been a huge part of my life to stay active, physically and mentally.
I'm always excited to find something that I haven't been able to try. So I think to have something introduced where there's new possibility and new possibility for your body. And so I think something like FES at this point in my life brings about this new possibility of like, oh, well, maybe I just haven't been able to tap into certain things in all of these years because I haven't had the tool, I haven't had the mechanism. There's just something really cool about looking down and seeing your body, seeing your legs doing something that they haven't done for 22 years. And that maybe you didn't think they were ever going to do again. There's something really profound about that.
Abby has an extremely rare syndrome called cerebrocostomandibular syndrome that affects the brain, the ribs, and the lower jaw, as well as the spine. We used the RT300 in inpatient therapy and realized the benefits of it. In the beginning, before we had the bike, she had therapy 3 times a week, and one of the days of therapies was only using the bike. And so that really kept them from being able to do as many other things during therapy. So once we got the bike at home, we didn't have to use therapy time. We could do that at home as one of her therapies that we do. And so it allowed her physical therapists to work on other skills.